Welcome, everybody. This is Tom Judd. I had the privilege of chairing the IFMBE Clinical Engineering Division, IFMBE CED. We've had some small challenges getting people onto the right place today, but I think many will join. And of course, this is being recorded. And in fact, some small difficulties getting this started is, compared to the incredibly difficult time everybody's having around the world now with coronavirus. And I appreciate what our profession is doing to try to stand alongside many others, you and your families, and the government's trying to address a very challenging issue. So in fact, CED has just stood up a website resource today that will assist and will help in other ways. Find out more about that coming soon. So this, as you know, is the first of 10 monthly webinars on unique clinical engineering competencies as we practice around the world. I'll be co-chairing this session, but the heart of the session is our three presenters. I'll be co-chairing with Dr. Yadin David out of Houston, Texas, and one of our colleagues, Li Bin, out of Shanghai, China, will be maybe online with us, but he will be participating by pre-recorded video. And our three speakers, as I mentioned, Roberto Ayala from Ministry of Health Mexico, the CENETEC organization, Ledina Picardi, Ministry of Health Albania, who leads that Ministry of Health Medical Device and Systems unit. And I mentioned Li Bin, who not only with his role in Shanghai, but is also the president of the Chinese Society of Clinical Engineering. Let's go to the next slide, Kelroy. The three presenters, I'll let you catch up. There you go. You can see the pictures of folks. Roberto will speak to health technology management, clinical engineering best practice from a public sector point of view and an in-house approach. Ledina Picardi from public sector and an outsourced approach that was right for the circumstances of her country. And then Li Bin from a quality system approach across many hospitals. Next slide, please. And we sent you an outline 3 weeks ago of this program today. So I'm not going to spend a lot of time, but we've got definitions of what we mean by health technology and clinical engineer as defined by WHO and HTM. So next slide, please. And Dr. David and I and others have put together 40 years of references and examples for health technology management. Most of them captured recently in the past 2 or 3 years. The video, the journal that Dr. David edits, definitions that we've gathered on our clinical engineering division website, but are almost entirely referenced by World Health Organization from our great Congress. Many of you were able to attend last fall, and so on down the way, including some from the late 1980s on this topic. Next slide. So one of the things we're trying to accomplish as we do these 10 unique clinical engineering competency webinars is to talk about 3 best practices in each of them. And each of the presenters today will take about 10 of their 14 minutes to talk about what they did and why it was a best practice that had a lot of success in their environment. But they will also take another 3 or 4 minutes to talk about, so what are the leadership principles that they needed to exercise to overcome barriers and the challenges, because we all know it's not easy to implement big programs. And we've listed 11. The ethics, number 10, we're modeling it so far off our colleagues at the American College of Clinical Engineering, and we have an appendix that will share more information about that. Next slide, and just before I end and turn it over to Dr. David, but next slide first, I will tell you what are we going to have for you at the end of this program today is we're going to have the PowerPoint slides with the appendix. We're going to have an MP4 audio file for those of you that live in the non-Google world. We're going to have a YouTube of the recording today, and then we're going to have in the appendix other slides that give richer material than we have time to cover today. So at the end of our time, with about 10 minutes to go in the hour, we'll have a question and answer period. You can put in your questions into the Q&A box, I believe, and the chat box, and we will try to address some of those in the last 10 minutes and be a part of the recording, but others we will address over the next week and get that information out to you. And we remind you that we have the next webinar on Wednesday, April 15th at the same hour, and we will send the outline ahead for that. So more to come. And I hope, Dr. David, you're with us now and could take over. Yadin?
Not necessarily we can concentrate and focus on the routine practice of clinical engineers and where we want to go with our profession. But nevertheless, I appreciate everybody breaking out from handling the crisis of the COVID-19 and come to join us. I do appreciate that, and I realize there are other stressing issues. But in order to meet those stressing issues, you do need to have certain characteristics. You do need to have the ability to lead, to put group working together towards the goal and achieve that goal. In Rome, October 2019, we figure out what are the most important issues that we would like to focus on in the next 2 years. And that's how we started this webinar, this series of these webinars, is by looking at those goals and objectives for the 2 years and see how can we share with you, how can we connect with you, how can we stimulate you, and how can we improve upon what we have reached so far. And I think that that would be a great opening for today. You know, everyone thinks of the changing world, but no one thinks about changing himself. It's a quotation from Leo Tolstoy, a famous Russian author that many of us read his books. This is what about we're talking. How can we change? How can we get this competency and skills of leadership to move ahead and have rewarding careers? For today's, we decided to look at both the public part of the healthcare delivery system, the private part, and then the combination of the two together. And today we're going to have presenters who reflect all those three and give you their life examples. Excellent lessons to be learned. The first one will be Lee Bin. Do we have the first slides for Lee Bin?
Actually, it's going to be Roberto's going to be first. Sorry.
Thank you, Tom. So the first will be Roberto looking at the example of private-public combination in Mexico. Then Ledina, Picardi from Albania will talk about how the Ministry of Health, the public segment, actually contracted with the private sectors in order to reach the goals. And then we'll go to Lee Bin, the director of the 6 People Hospital in Shanghai, that will talk about how he brought together a province of clinical engineers working together towards quality improvement. Very good lessons, and something that we need to think about is leadership. Leadership is the ability of putting together a group of people and move them towards reaching that target. This is what we're talking about, and this is what will be the focus today. I'm going to cut short my comments in order to get to the first one